Hello, I'm Dr. Thomas Perry, President of the Integrated Benefits Institute. Historically, employers have organized their health-related benefits programs in independent silos. But as every employer knows, these programs often target the very same people. In the words of one employee, when my company carves programs out, I feel like I'm being carved up. It is this perspective that is leading many employers to take a more holistic and integrated approach to managing the health and productivity of their workforce. They desire to integrate their health, absence, and disability-related programs with a more focused strategy. As employers move in this direction, they can't help but turn to the marketplace and ask, how can I get my vendors to follow me in this more integrated approach? We'll address this question in today's program through a conversation with Chris McSwain. In his work, first at SCANA and then at Whirlpool, Chris has led the way in developing innovative strategies that transform vendors into true business partners. He will discuss how those two organizations have been able to coordinate their vendor efforts to improve the health and productivity of the workforce. This DVD has two parts. The first is a discussion of key strategies and how to better coordinate vendor programs and activities. The second is an overview of the tools that can help in this transformation. These tools can be downloaded directly from this DVD.
But there'll be really three main issues that we focused on in our discussions today, Tom. The first is on the employee experience. The second is waste in the system and how to improve that. And the third is understanding and working through the differences between vendors, suppliers, and partners. But the real destination that we'd like to see all of the marketplace eventually evolve to is the partner space. These are very clear and easy to spot, to me the easiest of the three, because they own the problem. They understand what your strategies are, and they help you own the solutions to that. They tend to be very consultative in nature and helpful in trying to provide ideas and input about how you can make a difference for the people you serve. They have a real focus on innovation because they understand that that's their lifeblood. That's where they're going to progress and help others within the marketplace. We often see partners moving away from participation-based focus and moving much more towards outcomes-based. What difference have I really made? And then they tend to be very proactive. They come to us often having met with each other for the benefit of the employer to suggest proactive strategies that the employer should consider in driving change and really looking for those breakthrough results that I talked about earlier. You know, from my experiences, suppliers are not going to change by choice. You know, they need an employer to come behind them and help them understand the criticality of thinking differently and making this transition that we just talked about from vendor, supplier, to partner. Done well, effective supplier management can help us with all three of these major issues that we've just spent some time discussing. The employee experience, removing waste from the system, and effectively transitioning vendors to become better partners over time. We took our top 5 chronic conditions as identified from our data. Everything should start with the data. And we created a matrix that for each one of those 5 chronic conditions, we listed out our major suppliers. And then we contacted each one of those suppliers and asked them, what is it that you believe you do in support of each one of these 5 chronic conditions? And what we found really surprised us because there was hardly a single cell in that matrix that did not have an X in it. So again, an insight for the employer was that all of our major suppliers thought that they were all involved with our chronic conditions, which created a lot of concerns and even questions about what the employee experience must be like for our people if all these suppliers are all trying to help with the same chronic condition. The conversation that we had was absolutely astounding. I would say that it would be an understatement to say that many eyes were open because really for the first time many of our suppliers were beginning to learn about the other suppliers and the services that they offered. We actually saw laptops come out and said, hey, let me explain to you about what I could do to help in this particular situation. So a lot of progress was made. But one interesting facet that I think the employers need to know is that, ironically, the person in the room who knew the most about all of the capabilities of the suppliers was the employer. And we found ourselves going from table to table, knowing what we did and making sure that the supplier whose services we might have felt were not being discussed in the programs that they offered that we were valuing, that were actually acknowledged and described to the other suppliers. So we forced some conversations to happen that because these suppliers, all good people and good intended, so used to being in silos and operating in that somewhat of a constricted environment, we're finally breaking some of those boundaries and restraints and doing things for the first time.